The first operation I had done was my breast reduction, and then just recently I had a lower facelift. Lower facelift was just, I suppose, just like most women, once you get to a certain age, you start looking tired, you look in the mirror and you just kind of think, oh, I just wish this, you know, you actually do stand in front of a mirror and start doing this, and you just think, oh gosh, I wish. But now, of course, you know, you can, if you've got the money, then you can go and get the procedure done, and you just look, you look at before and after pictures and you think, you know, it does make a difference. And I know it sounds a bit vain, but at the end of the day, you've got to look at your face every day in the mirror, and if it can look a bit nicer, why not? You know, you go to a hairdresser, get your hair done. Okay, it's a little more expensive, but essentially it's the same thing. It just makes you feel better about yourself. I went up to Mr. Guava because I'd been with Mr. Guava before, and I do trust him, and I know his work is fantastic. So I made an appointment, went up to him. He explained again in great detail what happens, and I thought, okay, I'm just going to go for it. On the day of my procedure, it was really easy. I slept well the night before. I wasn't worried. I did feel I was going to be well looked after. I went up to the hospital, greeted at the door. The staff are always very nice and welcoming. I was asked to wait. I think I had to wait for about half an hour. I don't know why. And then I was shown to a bedroom. Everyone, I think, gets a single bedroom to themselves. And then the consultant comes in and he gives you an idea of what to expect. And then I think after that, if memory serves me well, you know, you have to sit in a dressing gown, or, you know, the kind of surgical gown that they give you. And then I think your face gets marked up. So that's a bit of an odd sort of feeling when you sort of, you know, big sort of black felt pen around your face, but clearly he's got to, because you're lying down, so he's got to know which parts to work on when you're when you've been sedated. But no, I mean, it's all done very sort of, you know, smoothly, and I didn't feel nervous at all. My immediate recovery, again, you do feel, you know, you do feel a bit weird, because you know, you've just woken up from however long it's taken the operation. You do feel a bit painful, but the anaesthetist does stay with you until you're fully recovered, and kind of tries to assess your pain level. And then after that, once, I think that takes about 20 minutes, half an hour, until they're absolutely sure that you're definitely okay to go back to ward. Then you're taken back to your ward on a trolley, and settled in, and then really it's just a case of, you want for nothing. You're not allowed to get up to go to the toilet. A nurse has to come and make sure that whatever you do, apart from just lying there, someone is assisting you, whether it's having something to eat. They're going to make sure that you can eat okay, because your face is quite swollen. You know, if something falls off your bed, you can't get up and get it, you just press the buzzer. So the nurses are great, they really are. They're just so nice. And 3, 4, 5 o'clock in the morning, I'm sure they must be fed up because they've got so many patients to look after, but they come in with a smile and they're just so nice. After the surgery, initially I didn't feel that great because, well, certainly for the first day, your face is very swollen, you've got bandages all over, and it really packed bandages, so you know, the bandages are out to about here. So you actually look like you've done about 3 rounds with sort of, you know, a wrestler or a boxer or something. But clearly that's what you're going to expect. It's fairly uncomfortable because you can't lie. You've got to sit up as well. That's one thing I've forgotten. Certainly for about the first couple of weeks, they do advise you not to lie down. I don't know, obviously, if it's blood, you know, goes to your head or something, but they tell you to sit up as much as you can when you're sleeping. And that in itself is very uncomfortable. But it is quite painful, I have to be honest. You know, certainly the first few days, it's sore. They do give you painkillers. The painkillers are just paracetamol. And I was taking a lot of paracetamol. And I did feel, I think on day 3 or 4, I did think, should it be as sore as this? Because I really didn't think, having had the previous operation okay, a different part of your body, but I had literally no pain when I had the breast reduction. And, you know, I don't even think I took a paracetamol once. And I felt this was the polar opposite. So I did, and I think it was a weekend day as well, a Saturday, I phoned, and Spire did manage to get me fitted in to see one of the nurses. And she kind of said, no, look, it should be like this. Don't worry. Yes, it is painful, but because you've had a big operation. But she said it will settle down. And it did take a good few weeks to settle down. It did take at least a week before I didn't feel it was very painful. But, you know, you just have to be realistic and think, well, just give it time. This is me now into the 5th month. And, you know, sometimes it can be a little uncomfortable if I put my head, you know, on something that's hard, maybe, you know, just not the pillow or something, you know, then you can feel, and it's still quite numb here, and this is 5 months later. But, you know, really, Mr. Gwaba did say right from the beginning, it will be 6 months. Give yourself 6 months, and clearly it will be 6 months. And that's, you know, that's true. The best thing about having the procedure are, you know, are the after effects. It does take months, so as I say, you have to be realistic, but after you've had the procedure and you look in the mirror and you see someone who's 10 years younger and you think it was all worth it.